Hi, good morning or good afternoon. Thank you so much for joining us for the webinar on supporting the learning and health connection through ESSA needs assessments. We are just getting started, so if that's the webinar you were calling in for, you are in the right place. This is Nancy Katz. I'm the Director of School Partnerships for the Alliance for a Healthier Generation. The Alliance for a Healthier Generation and Healthy Schools campaign are co-hosting today's webinar. And we're really excited that you could all join us and hope that you will enjoy the webinar. Before we get started, we just want to go through a few logistics. The webinar will run for approximately 1 hour, and we will be recording the webinar, and that will be available to view after today. We'll email a link to the recording and slides by the end of the week. And also at the end of the webinar, if you could take a minute to complete a quick survey, we'd really appreciate it. We'll save 15 minutes at the end of the webinar for question and answer session with our speakers. You can ask questions by typing a question into the questions box located on your control panel and clicking the send button. Feel free to send questions throughout the session, but we'll answer all questions at the end of the session. Next slide, please. So these are today's speakers. We have a great panel today. Just briefly, we have Kimberly Light from the U.S. Department of Education, who's going to talk about the needs assessments requirements within ESSA and the guidance and resources coming from the Department of Education. Alex Mays from the Healthy Schools campaign is going to talk a little bit about the learning and health connection and the opportunities that are presented through the needs assessment to forward health and wellness. And then Lori Paisley from the Tennessee Department of Education is going to give a great example of one state and their efforts to integrate health and wellness into their needs assessments. And as I mentioned, I'm the moderator, Nancy Katz. And I'll tell you, just to get us started, a little bit about a Alliance for a Healthier Generation, and later on when Alex Mays speaks, she'll tell you a little bit about the Healthy Schools campaign. The Healthy Schools campaign and the Alliance have been working together for about the past 2 years on efforts to integrate health and wellness into education policy and practice through ESSA implementation. The Alliance for a Healthier Generation is a national organization. We work to ensure that the places where kids spend their time support and promote good health. So we do most of our work in schools and out of school time sites, as well as some juvenile justice facilities. And we also work in the marketplace arena, trying to ensure that children have access to healthy foods, both in school and out of school time sites, but also in their communities. And so this ESSA work has been a really great fit with Alliance for a Healthier Generation to find a way to really look at that policy level at the state and federal level and see how we can really ensure that the education environment is really supporting those healthy environments. Next slide, please. So as some of you I'm sure already know and may have read in some of the previous resources that we've released, ESSA presents important opportunities to support health. To support student health. As I mentioned, the Healthy Schools campaign and Healthier Generation have been working together to ensure that states develop strong school quality measures that reflect health, that health measures are included on school state report cards, and that they're integrated into needs assessments and that are required under ESSA. And that's really the focus of today's webinar, is specifically the needs assessment component of ESSA. Next slide, please. So now I'm going to turn it over to Kimberly Light. We're very grateful that she's joining us today from the Office of the State Support in the Office of Elementary and Secondary Education at the U.S. Department of Education. She leads community of practice and partnership work as part of the office's technical assistance team and also serves as a state program officer. Prior to her work in the Office of State Support, she was a state team lead and technical assistance lead in the Office of School Turnaround, and served the majority of her federal career in the Office of Safe and Drug-Free Schools, where she managed a wide range of grant programs and projects related to school health and safety and drug and alcohol prevention. So now I will turn it over to Kim.
Thanks, Nancy. I'm glad to be here and be a part of this webinar. Coincidentally, our office is going to be holding a webinar tomorrow afternoon, June 6th. That'll be a great follow-up to this webinar, so this is really timely. We're going to be introducing a new needs assessment guidebook to support the development of district and school needs assessments. So some of you on the webinar today may want to participate in that webinar if you're available, and I'll provide the link later in the slides, and we'll also provide the link within the chat box as well. A lot of the information I'll be sharing today is also included in the guidebook. So today I'll be providing a brief summary of the Every Student Succeeds Act and the status of the state ESSA plans, and then I'll provide an overview of needs assessment requirements in ESSA and other ed guidance related to needs assessment. And then I'll end with sharing some relevant needs assessment resources. Next slide, please. As you may know, the Every Student Succeeds Act, ESSA, which amended the Elementary and Secondary Education Act of 1965, or ESEA, was signed into law on December 10th, 2015. And this was an important update to the Elementary and Secondary Education Act and provided new opportunities for state flexibilities while maintaining civil rights guardrails and providing both flexible and targeted funds to support students with particular needs, such as students from low-income families and English learners. The ESEA, as amended by ESSA, reflects a shift in U.S. education policy toward greater state and local decision-making. And the ESEA recognizes that context matters and that states and districts should have that flexibility to determine solutions that'll best address the specific needs of their students, schools, and communities. Next slide, please. This is a visual summary of the ESSA implementation timeline that we've been involved in our office over the past couple of years. To implement ESSA, states develop new plans that align with the new law, and ED must review and approve applications under the new law. States worked throughout 2016 on new approaches, and following the transition to a new administration and the Congressional Review Act, the revised template released in March 2017 adjusted some of the specifics of the information states needed to provide in order to be approved. ED has been approving these plans through 2 windows, and we're currently wrapping up the second of those windows, which is the last small blue circle on the right. Once they have an approved plan, states will implement the new approaches they developed, and ED will monitor and support them. And all states must have plans approved for the 2018-2019 school year. Next slide. This slide shows in green those states with approved state plans. And as you can see, most states have approved plans at this point. 46 plans from states, DC and Puerto Rico have been approved, and 6 plans are still under review. All the remaining states have requested extension of the 120-day timeline, and the department is working closely with these states to provide assistance and feedback so that they can be approved as quickly as possible. Next slide, please. States and districts must complete a needs assessment in several areas across major programs included in the law, including programs under Title I, Title II, Title IV, and Title IX. And of these programs, the Office of State Support has responsibility for administering Title I, and the other programs listed are administered by other offices in the Office of Elementary and Secondary Education or elsewhere at ED. Next slide, please. Under Title I, Part A, to assist schools identified for comprehensive support and improvement, the LEA must locally develop and implement a comprehensive support and improvement plan for each school identified that is based on a school-level needs assessment. In addition, the comprehensive support and improvement plan must be informed by all of the statewide accountability indicators. It must identify resource inequities, include evidence-based interventions, and be approved by the school, the LEA, and the SEA. Next slide, please. To inform a comprehensive plan for schools operating a school-wide program, the school must conduct a comprehensive needs assessment. Of the 2 types of Title I programs that an LEA can operate, targeted assistance or school-wide, only school-wide permits the LEA to use Title I funds to support comprehensive school-wide reforms. In a school-wide program, an LEA may use Title I funds to implement reforms to upgrade the entire educational program of the school. In contrast, in a targeted support program, an LEA may use Title I funds only for Title I students, that is, those that are failing or at most risk of failing to meet the state's academic achievement standards. A school-wide program is a comprehensive reform strategy that is designed to upgrade the entire educational program in a Title I school in order to improve the achievement of the lowest achieving students. And generally, a school may operate a school-wide program if it meets any of the following conditions. A Title I school with 40% or more of its students living in poverty, regardless of the grades it serves. A Title I school that receives a waiver from an SEA to operate a school-wide program without meeting the 40% poverty threshold, or a Tier 1 or Tier 2 school in a state that requested and received a waiver through the School Improvement Grant Program that receives funds to implement one of the School Improvement Grant Program intervention models. Next slide, please. Conducting a comprehensive needs assessment is an important required component of a school-wide program. To ensure that a school's comprehensive plan best serves the needs of those children who are failing or at risk of failing to meet the challenging state academic standards, the school must conduct a comprehensive needs assessment. Throughout the needs assessment, a school must consult with a broad range of stakeholders, including parents, school staff, and others in the community, and examine relevant academic achievement data to understand students' most pressing needs and their root causes. The comprehensive school-wide plan then describes how the school will improve academic achievement throughout the school, but particularly for the lowest achieving students by addressing the needs identified in the comprehensive needs assessment. Next slide, please. Title I schools with less than 40% low-income students or that choose not to operate a school-wide program offer a targeted assistance program in which the school identifies groups of students who are failing or most at risk of failing to meet the state's academic achievement standards. Targeted assistance schools design, in consultation with parents, school staff, and district staff, an instructional program to meet the needs of those students. Both school-wide and targeted assistance programs must use instructional strategies based on scientifically based research and implement parental involvement activities. And a targeted assistance school may also provide comprehensive services such as health, nutrition, and other social services if these services are not otherwise available to eligible children. And the school must have engaged in a comprehensive needs assessment and established a collaborative partnership with local service providers. And it must be determined that the funds are not reasonably available from other public or private sources to provide such services. Next slide, please. So outside of Title I, there are several other titles that include needs assessment requirements. Under Title II, Part B, as part of a state's application for a comprehensive literacy state development grant, it must include a needs assessment that analyzes literacy needs across the state and in high-need schools and local educational agencies that serve high-need schools. Next slide, please. Under Title IV, Part A, any LEA that receives a student support and academic enrichment grant in the amount of $30,000 or more must complete a comprehensive needs assessment prior to receiving its allocation to examine needs related to a well-rounded education for all students, school conditions for student learning in order to create healthy and safe school environments, personalized learning supported by technology, and professional development for the effective use of data and technology. And this needs assessment must be conducted every 3 years. If the LEA has recently conducted a needs assessment that corresponds to the SSAE sections, then the district might want to consider how to best incorporate the information for the completed needs assessment into the comprehensive needs assessment that's required for this program. Next slide, please. Under Title IV, Part F, the Promised Neighborhoods program requires applications for Promised Neighborhoods funding to include an analysis of the needs and assets of the neighborhood, including the size and scope of the affected population, how parents, families, and community members were engaged in the needs and assets analysis, an analysis of community assets and collaborative efforts that are underway, the steps to address the needs identified, and any barriers to meeting such needs. Next slide, please. Under Title IV, Part F, to apply for community support for school success funding, an eligible entity must submit a description of a needs assessment that identifies the academic, physical, non-academic, health, mental health, and other needs of students, families, and community residents. Next slide, please. And finally, under Title IX, Part B, states that receive an ESSA preschool development grant must conduct a periodic statewide needs assessment of the availability and quality of existing programs in the state, including programs serving the most vulnerable or underserved populations and children in rural areas. And the Secretary of Health and Human Services, jointly with the Secretary of Education, will make awards under the ESSA Preschool Development Grants Program. So as you can see, there are a variety of different needs assessment requirements in ESSA that can potentially be coordinated, aligned, or integrated across programs. Next slide, please. The importance of needs assessment as part of a continuous improvement process is described in the U.S. Department of Education's 2016 non-regulatory guidance, which notes how needs assessment both strengthens effectiveness and supports better outcomes for students. Next slide, please. The ED guidance also describes the steps of the continuous improvement process as a 5-step cycle. The needs assessment process is an important first step in improving effectiveness and helping educators identify, understand, and prioritize the needs that districts and schools must address to improve performance. Identifying priority needs is the first in a series of closely tied steps that also include understanding root causes that contribute to the areas of need, selecting evidence-based strategies that address those needs, preparing for and implementing selected strategies, and evaluating whether those strategies are addressing improvement needs and achieving desired results. So the needs assessment becomes the beginning step of each iteration of that continuous improvement cycle. Next slide, please. The ED guidance also includes key questions to consider in identifying local needs that are listed here. SEAs and LEAs should engage in timely and meaningful consultation with a broad range of stakeholders, including families, students, educators, community partners, and examine relevant data to understand the most pressing needs of students, schools, and/or educators, and the potential root causes of those needs. Interviews, focus groups, surveys, as well as additional information on students, including assessment results, grad rates, information on schools, which could include resources and climate information, and information on educators, including effectiveness and retention rates, can provide important insight into local needs. Next slide, please. And the next several slides include links to a range of needs assessment resources that are available through the ED website or websites of ED-funded TA providers or external partners. The Office of State Support Technical Assistance resources can be found at the link here, and specifically related to needs assessment is an LEA series webinar on planning for success using evidence to identify local needs and select relevant evidence-based interventions that you might find helpful. Next slide, please. Other needs assessment resources can be found at the website of the Office of State Support's TA contract, the State Support Network, and the general link to the network is the first link listed at the top. The first two resources listed are resource compilations from 2 recently completed communities of practice. The Implementing Needs Assessment COP supported SEAs that had begun the rollout, pilot, or implementation phases of needs assessments in their state. And the Scaling Needs Assessment COP supported SEAs that were early in the process of developing needs assessment tools and processes to support local districts. Both of these sets of COP resources include those developed by both subject matter experts as well as states, so you may find them helpful. The Needs Assessment Guidebook, which is listed here and that I had mentioned earlier, is designed to support state and local leaders in the development and facilitation of a needs assessment and presents a practical approach to addressing the elements of needs assessment and supports that states can provide to districts and districts to schools in the implementation of effective needs assessment. And the webinar that's going to be held tomorrow afternoon will walk through this resource, and it can be accessed at this link listed here, which will also include in the chat box, so you can get immediate access to that in case you'd like to participate tomorrow afternoon. It's, I think, between 2:30 and 3:30 tomorrow afternoon, Eastern time. And you could also access it by going to the State Support Network general link above, and can link to it from the homepage under Attend Events as well. A resource that will be posted soon is a needs assessment blog series that will highlight states that have created a singular statewide needs assessment in order to streamline and coordinate needs assessment efforts and reduce burden on state and local staff. So that is coming soon. As states develop needs assessment processes under ESSA, we're finding many are seeking to eliminate redundancy while breaking down silos. This, I think, will be a really beneficial to states and others that want to hear about how other states are approaching this, including their challenges and strategies for success. And then the last resource listed here is a Center on School Turnaround tactical guide that was developed jointly with the Council on Chief State School Officers, which describes core components for developing and administering state assessments for improvement. And this resource in particular includes some worksheets that are included to help users design and develop needs assessments for schools and districts, and a companion document that has the worksheets in a format that can be completed. Next slide, please. And this last slide includes guidance documents that are available on the ED website that have been referenced throughout this presentation, and that may be helpful in developing and implementing needs assessments, and includes both using evidence to strengthen education investments, supporting school reform by leveraging federal funds in a school-wide program, and also more guidance around student support and academic enrichment grants. And so now I'll turn it back over to Nancy, and I can answer any questions you may have at the end of the webinar.
Great, thank you so much, Kim. That was really informative. And just to reiterate, we will be sending out the slides and a recording, so you'll be able to access all of those great links that Kim provided in her presentation. And also just one more reminder that we did post in the chat box the link for the webinar that Kim referred to. So that is on your control panel, and you can click the little arrow next to chat and it will expand the chat box if you want to get right to that link. And so now we're going to move on to Alex Mays. Alex is the National Program Director at Healthy Schools Campaign, where she works on policy and program issues at the federal, state, and local levels related to school food and fitness, health services, and education. She currently leads Healthy School Campaign's work to support the health and learning connection through implementation of the Every Student Succeeds Act. So I am very lucky to work with Alex on a daily basis on this work, and it has been a pleasure. In addition, she oversees the Healthy Schools Campaign's efforts to increase access to school health services through Medicaid reimbursement. And I'll turn it over to you, Alex.
Great. Thank you so much, Nancy. I just want to make sure, can you hear me okay, Nancy?
I can. Thank you.
Perfect. Okay, just checking. Thank you so much, and thank you to Kim for that wonderful introduction to the Every Student Succeeds Act and needs assessments with requirements within the law. So again, my name is Alex Mays. I'm with Healthy Schools Campaign, and we are co-hosting today's webinar with Alliance for a Healthier Generation. For those of you who don't know Healthy Schools Campaign, we're a Chicago-based nonprofit, and all of our work sits at the intersection of health and education. And so we work to ensure that health and wellness are integrated throughout education policies and programs to make sure that health and wellness can be incorporated throughout the school day and doesn't just get being one single subject or one time a day. We want to see it as a part of the school and as a part of how people think about supporting student success. And we have had the pleasure of working with Alliance for a Healthier Generation for the last 2 years around implementation of the Every Student Succeeds Act. And we really see ESSA as a tremendous opportunity for supporting health and wellness and driving forward this connection between learning and health. As Nancy shared earlier, there's some really exciting new opportunities within the law, including changing how states are thinking about accountability for schools and requiring reporting on school quality, requiring the inclusion of chronic absenteeism within report cards, along with a host of other measures, and then just generally increased flexibility around how resources and programming can be used within the law to support the whole child. And we really see needs assessments as a very important opportunity within the law for supporting the learning and health connection. And as you know, Kim did a great job of walking through all the requirements. We really see, at the core of these requirements is gathering data to inform effective investment and programming to support better outcomes for kids. And given the critical connection between learning and health, we believe that incorporating health and wellness within those needs assessments can be a really great strategy to elevate the role that health can play in student success. So next slide, please. So in case it hasn't been clear from the intro, core to this work is really lifting up that connection between learning and health. We know that far too many kids are coming to school with chronic health issues such as asthma and obesity that can impact their ability to learn. And unfortunately, many students don't have the opportunity to learn in a healthy school environment. And so we really want to look at how we can leverage the Every Student Succeeds Act to support that connection and to really recognize that if a student isn't healthy and in their seat ready to learn, that's going to have impact on their ability to succeed. And when we think about a healthy school environment, we try to use the broadest definition possible. So when you hear us refer to school health throughout this presentation, we like to use the framework that has been put out by ASAD and the Centers for Disease Control and Prevention called the Whole School, Whole Community, Whole Child model, which is up on your screen on the right, and just demonstrates the different components of what a healthy school environment can be. So when we talk about a healthy school environment, it's access to health services, to healthy school food, opportunities for physical activity, supporting staff wellness, environmental health, and many other components. And that's really what we want to be empowering communities and school districts to do, is to use the needs assessment as an opportunity to understand what the unique health issues are within their student population and identify evidence-based interventions that can be used to address those needs. As far as needs assessment goes, and they can really be used to support that connection. There was a recent analysis that was put out by the Health Impact Project, which is a collaboration of the Robert Wood Johnson Foundation and Pew Charitable Trust, that looked at how needs assessments under ESSA could be used to improve achievement. And what the report concluded was that school districts could more effectively improve student outcomes if they looked at factors outside of traditional academic factors, such as school health. And so the conclusion of that work for the Health Impact Project was that integrating health and wellness along with other outside factors could really help improve efforts to support student success. Next slide, please. So our work on needs assessments, you know, as Kim shared, there are many opportunities for supporting needs assessments within ESSA. A lot of our work has really focused in on the requirements in ESSA for needs assessments for schools that are identified for comprehensive and targeted support and improvement. We know that, you know, often these are schools that are disproportionately serving low-income students of color, and unfortunately, these are also the students that are more likely to come to school with chronic health issues and more likely to attend school in a school that might not be as supportive of their health. So they're less likely to have access to a full-time school nurse, less likely to have access to regular opportunities for physical activity, et cetera. And so we've really focused in our recommendations around the opportunities within ESSA for supporting underperforming schools, but certainly the recommendations that we have, you know, are relevant throughout the requirements. ESSA, another change that it made was requiring states to develop a measure of school quality for their state accountability systems. And so schools are identified for improvement based on goals that are set by the state for indicators that are included within their state accountability systems. And many of these indicators are what you might consider more traditional, you know, academic indicators, such as performance on English language arts and math and high school graduation. But ESSA gave the opportunity for states to select a school quality measure of their choice. And what we've seen in the plans that have been submitted is that the majority, 36 in DC, have included chronic absenteeism as a part of their school quality measure. And then in addition, we saw a number select measures around physical education and school climate too. And so, you know, while certainly a strong case can be made for the role that health plays in supporting overall academic achievement, the inclusion of the school quality measure in states' accountability systems creates a really important opportunity to lift up the role that health can play in impacting these accountability measures, which can be a very important opportunity to make the case as you're trying to move this work forward in your state. So if you haven't already, I would encourage you to go onto your state Department of Education's website and look at your ESSA plan and really see what your state included in their accountability system, because these are what schools are going to be held accountable for. And in turn, as you're thinking about the role that needs assessments can play in driving school improvement and supporting this work, linking the work that you're doing to those accountability measures can be a really effective strategy for making that case. Next slide, please. And so to really support this work and support state and district level efforts to include health and wellness within their needs assessment, earlier this year, Alliance for a Healthier Generation and Healthy Schools campaign released a guidance document, and we will be sure to send out the link to this in the follow-up email that goes out with this webinar. But the guidance really looked at, you know, dug into what are the questions that can be included within needs assessments that lift up the health and learning connection and can help schools understand what might be some of the health-related root causes of that are impacting student success. States are approaching the needs assessment differently, but many are looking at developing guidance to support school districts in conducting strong needs assessments. And so that's a really important opportunity to ensure that health and wellness questions are integrated in any state level guidance. And that's really, you know, was a core goal of this guidance, was to lift up, you know, what are recommendations that could be included within state level guidance, but then also, you know, that ultimately it'll be the school districts and schools that are doing these needs assessments. And so this guide includes a lot of great information, you know, as far as the health and wellness questions that can be asked to inform their work and help them understand, you know, what we have, if we have a really high rate of chronic absenteeism, what are some of the causes of that related to student health, and what are steps that we could take to address that. Next slide, please. And so in developing our guidance, these are the kind of categories that we focus on developing questions for. This will look very familiar. It's based on the diagram that I shared before, the whole school, whole community, whole child model, and really just outlines, sample questions that you can be including within your needs assessments to emphasize that learning and health connection and being sure that that's not overlooked. In our work on needs assessments, we feel it's really important to work with school districts and schools to recognize what health and wellness data they already have and already have collected. And so many of our recommendations have been based on, looking at the data that's already being collected and determining how it can be integrated within needs assessments. We know that districts and schools have a tremendous amount of work on their plate. And so by no means do we want to be recommending that they complete an entirely new survey to collect health data to inform the needs assessment. So we've really focused in our work on, connecting this to existing policies and programs around school health that are in place and looking at how existing data can be leveraged. Next slide, please. And so on the next slides, I've just highlighted a handful of the questions that are included in the guidance that we've been working with states to try to implement within their needs assessment guidance. I won't read through these in detail, but just to give you kind of a flavor for the level at which we've included recommendations to states around what can be put into state level needs assessment guidance that's being developed. So in school health services, really looking at what type of access to healthcare providers is available within the schools. And we've also included questions, to look at what leading student health issues are that could be impacting academic achievement. And on the next slide, it just shares a sample of questions related to school nutrition. So again, looking at what is the low-income population's utilization of free school meals, are best practices being used to offer programs like breakfast in the classroom, and are, beyond school meals, are healthy policies and programs being put in place. And then the next slide highlights some of the physical activity questions. So again, just really getting at that link between physical activity and learning, and lifting up best practices around access to physical education and recess and physical activity. And on the next slide, just to reemphasize that the questions that we've been working with states to include in their needs assessment guidance have been really based on where we feel like there is existing data that they have that they can utilize. So schools are reporting a number of these measures to the Department of Education's Office for Civil Rights, as a part of health information cards that students turn in at the beginning of the year. There's a wealth of information that can be utilized to better understand health issues that are impacting student population, and then a number of other sources of data as well. So on the next slide, just to conclude, as far as how you can get involved in this work, I mentioned that many states are in the process of developing guidance on needs assessment. It's a fantastic opportunity to weigh in and help and provide input on what you would like to see included within those needs assessments, and then same at your district level to engage with the superintendent and the folks that are implementing this programming, and really, especially if you bring expertise and knowledge around school health and what the health issues are that could be impacting a student population, that's valuable information that can be shared with leadership to help inform their thinking about the needs assessment. And then certainly, keeping in mind about how you can link the role of student health to the accountability measures that your state has selected under the new education law. And then, for folks that are within other sectors, especially public health and, hospitals and health sector representatives, many people bring extensive expertise around needs assessments too. All nonprofit hospitals are required to do community health needs assessments, and it's something they've been doing for a number of years. And that expertise can be incredibly valuable to districts as they, work to implement their needs assessments. And so really encouraging you to engage with leadership at the state and local level to inform the work that is happening around needs assessments. So I will now hand it back to Nancy, who I believe will introduce Lori, who's going to do a spotlight on the work happening around us in Tennessee. So Nancy, back to you. Oh, actually, I think next slide. Sorry, I realized I think there are a few resources, sorry, just to highlight. We'll again send this out to everybody, and it has links to our guidance on the needs assessment and then some additional resources we put out around ESSA. Next slide. Great, and now I will hand it back to Nancy. So Nancy, please take it away.
Thanks, Alex. Thank you so much. So we'll move right into Lori Paisley, who's the Executive Director of Coordinated School Health at the Tennessee Department of Education. Prior to this role, she served as the Director of Special Projects for the Deputy Commissioner of Education and the Office of Safe and Supportive Schools at the Tennessee Department of Education. She served as the Coordinated School Health Supervisor for Putnam County Schools, where she was responsible for all 8 components of coordinated school health, and also served as the 504 compliance specialist, homebound supervisor, school safety contact, as well as supervising over 70 employees in the areas of school counseling, school nursing, social work, and physical education. Lori was a special education consultant for her district for 6 years and was a special education teacher for 7 years prior to that. She started a system-wide program for students with severe psychological disorders for Putnam County schools in 1996, and that program is still going strong. So we are very grateful to have Lori and her vast expertise on school health and wellness to join us today.
Thank you. Next slide. So I'm going to be talking about how in Tennessee we are supporting student health through our ESSA needs assessment. Next slide. And I always like when I'm talking about ESSA, and I've done these webinars, to share our logo, which we're pretty proud of. We have a motto, if you will, and our strategic plan is that Tennessee succeeds, and we were able to include ESSA in that. So I'm going to lead into what we do in Tennessee with this graphic for you all. Next slide. So our implementation in Tennessee, I know they talked about how some states are still coming on board, but 2017-18 school year was our first year of implementation. And currently we are reviewing districts' second year funding applications. But for us here in Tennessee, every school and every school district has been required to complete a needs assessment every year, even before we went to that in ESSA. So for us, it was a pretty seamless transition to do this and to continue with what our schools and school districts are doing in the area of needs assessment, but with some new guidance, and refresh that process with the ESSA requirements in this area. In Tennessee, we have 8 regional field offices. They are the centers for regional excellence. We call them the core offices. And those core offices are charged with providing support to the school districts within their region. So we have 8 core offices with a core director and consultants in many areas, and they support the schools and school districts within each of their regions. And they're a part of our statewide system of support and work really closely with the districts throughout the year on everything, but they definitely support their districts in their ESSA plans and their ESSA needs assessments. Next slide, please. So with ESSA, I'm going to share a little bit about how we address the whole child in the needs assessment in our state. So we're currently piloting a new needs assessment tool, and in that tool, we have identified, in my office, my division of Healthy Schools, we've identified the top 5 metrics that we wanted district leaders to consider when they're evaluating their school health and school nutrition programs. So in that pilot and in that new needs assessment tool, we have health metrics that are included in our statewide needs assessment, the nurse visits resulting in return to class, students who are overweight or obese, students with chronic health conditions, schools that are providing universal breakfast programs, and then schools that are compliant with our physical activity law. In Tennessee, we have a physical activity law that has a requirement for the number of minutes for students in elementary, middle, and high school. That law has undergone some amendments as of late. It was amended this past year, amended before that, the year before in legislative session, but we feel very good about the physical activity law that we currently have that's in place. And my office works with supporting schools to make sure that our students get the physical activity that we feel like they need. But a way for us to do that in a needs assessment is, again, to have those district leaders consider that when they're evaluating their school health program. So we want to know the number of schools in that school district that are compliant with the physical activity law. For example, that's one of the metrics. And there's a percentage there of how many schools. We always want that to be 100%. But if a school district and those district leaders see that it's not, then they can actively work in that area to ensure that our students are getting the physical activity that they need. So that's just an example of one of those metrics that we have included in our statewide needs assessment. And the pilot project that I mentioned was completed this year with 11 districts. So those 11 districts that we worked with our core offices to select have completed the new tool in their needs assessment. And we're getting feedback from those pilot districts now, and we plan to continue to move forward, but in January, the rest of our state will be coming on board with that new tool in their needs assessments. Next slide, please. So that new tool takes our districts through those 5 health metrics that I talked about, and they then select a metric to dive into a little deeper. And when they do, their data is pre-populated for them to consider and evaluate those needs. At that time, they can break out the results by grade, by school, and that tool asks them how that metric varies, say by grade. How does it vary by school? How does it vary by year? When you're looking at some of that data, you may want to go back to previous years. You may want to look at it in an elementary school, by grade, look at kindergarten, but also look at 2nd grade. And within a district, you can look at all of your elementary schools and how that varies across the district. And this tool leads them into addressing next steps by considering how they are addressing those challenges related to each of those health metrics, and then how they're incorporating the district's coordinated school health action plan into their larger district strategic plan for improving the health of their students. So we have all of our coordinated school health coordinators across the state. Again, we have one in every school district that develops a district action plan based on their own needs assessment, which is the School Health Advisory Council, Healthy Schools Teams, and School Health Index. So they submit those every year for their school district to my office, and they work off of those action plans. So this new tool has allowed us to really connect those action plans into the overall larger district strategic plan. Next slide, please. So the data sources that our schools and our school districts use to inform their needs assessments in Tennessee are all of their coordinated school health data. Those are available, and they're encouraged to use those for informing their needs assessment. So our coordinators in each of our school districts collect data in all of the component areas, and they report on those educational outcomes annually. Also, nurses across the state collect health services data and report those annually. That includes the scope of school health services and chronic health conditions data. And then school health screening data is also collected and reported annually in order to detect those health-related problems that can limit our students' ability to learn. So these are some of those examples in health that they already have. They have a lot of rich data at their fingertips and have for years. So this new tool has allowed us to align that for them. And as I said earlier, really guide them into digging a little bit deeper, considering all of this, evaluating all of this data that they have to plan for improvements so that they can make sure that their students are healthy and ready to learn. Next slide, please. So again, I talked about the action plan that each of our coordinators in our school districts submit and develop for their school district. They're shared at the local level, but they're submitted here in my office at the state level. And those action plans include 3 goals that are based on the needs of the district and the educationally relevant health disparities that cause our students to miss school and or not be successful at school. Also, our physical activity, physical education data is collected and reported annually. So we report to our legislature on how our schools are doing for our students in physical activity as well as PE. And then school nutrition breakfast data is collected at the state level, and our state office of school nutrition provides support to improve student breakfast participation and nutrition for our students. Next slide, please. So ESSA has impacted our needs assessment. As I said, we were doing needs assessment prior to ESSA being signed into law, but how ESSA has impacted our needs assessment can really be broken down into our new measures for school quality and student success. So when we were developing those new measures, the metric that we chose is called chronically out of school. And that chronically out of school metric represents additional measures of school quality and student success that reflect the priority interests of our Tennessee stakeholders. I know Kim talked about that a little bit earlier, but that was really what was driving us deciding upon chronically out of school as part of that measure. So ESSA's specific acknowledgement of supporting the whole child has allowed us more integration of student physical and mental health and overall wellness in Tennessee statewide. As I mentioned, we've had coordinated school health in every school district for 11 years. However, with ESSA specifically acknowledging the whole child, that allowed us to really drive and guide each of our schools and each of our districts to really integrate what we were already doing into our plans. Our strategic plan has had the strategy of all means all, and that clearly aligns with ESSA's work in creating safe and healthy learning environments. So again, we had that foundation, but ESSA impacted our needs assessment by making that connection even more clear for our schools and our school districts. Next slide, please. Our coordinated school health programs across the state can be supported by that new flexibility in ESSA that allow the districts and the schools to use those federal dollars for many of these supports that we've had in place, as well as trainings for teachers if that is identified in the needs assessment on that local level. And then our student physical and mental health are part of student supports, which is one of the 3 identified evidence-based levers that are foundational in the comprehensive plans for improvement that districts and our priority schools here in Tennessee will develop. So that was really an easy alignment and a clear transition there. And then the well-rounded components, including health and PE, and our focus has been established in those areas again for years. So with well-rounded in ESSA, that really impacted our needs assessment because we've been focused on health and PE here in Tennessee for years. It's in law here, and there's been, again, a lot of legislative and leadership support from the top down for healthy students. And so that really lined up well with ESSA's well-rounded components for us here in Tennessee. Next slide. I believe that's it.
Great, thank you so much, Lori. We just have a couple minutes, and there are 2, I think 3 questions in the chat box. The first one is was about the needs assessment and whether the needs assessment is the same for all programs. And I believe, Kim, you touched upon this a little bit. You talked about the blog, about states that are developing singular needs assessment. So maybe you could just say a word or 2 about that.
Yes. We're putting out a blog series that'll be interviews with a couple of states that have developed a singular statewide needs assessment. So that is a direction that some states are wanting to go in order to create less burden at the local level, as well as kind of, as I mentioned, breaking down the silos between these programs and looking for alignment and integration. So that is something that states are definitely looking at in some cases. So I think that blog series will be, really helpful for states and others who are interested in looking at those kinds of, integrated approaches.
Great. So it wasn't a federal requirement, but many states are trying to streamline that process so that there's not a different needs assessment for each component of ESSA.
Correct. Yeah, it's not a federal requirement that that's done, but I think a lot of states are interested in doing something.
Great. Thank you. The next question that someone asked is whether looking at trauma was part of ESSA. Alex, do you want to maybe say a word about that? And then Lori, maybe a word about how you all are factoring that in Tennessee?
Sure, I can take a first shot at it. So as we mentioned earlier, ESSA has a tremendous amount of flexibility in terms of how the resources and programming can be used. And so there are a lot of opportunities for advancing work around trauma. And I know there's a lot of great work taking place in schools around the issue, and the need is so high. And so certainly, looking at, as Kim talked about, with school-wide programming and comprehensive support programming, there were definitely opportunities to support trauma through that work. The law does include, in a number of places, actually specifically references the need to support student mental health. And so, for example, under Title II, which is the professional development program, the law specifically calls out how professional development funding can be used to support teachers and school staff around linking students with mental health supports. And so there's a number of ways in which it's specifically called out within the law, but certainly, programming around trauma-informed care in schools would be directly in line with a lot of the whole child language and supports that are in place within ESSA.
Great. Lori, did you want to add to that?
Yes, I pretty much echo what Alex says, but in Tennessee, we've identified 3 evidence-based levers that, as I said earlier, are foundational in those comprehensive plans for improvement. And just like Alex said, mental health is part of student supports. We also have the multi-tiered system of supports included in our ESSA plan, and we're working with districts now, and that includes ACEs, obviously school counseling, and then mental health programs. And also we have Project Aware. I believe Sarah Smith, our Project Aware director, had signed up to be on this webinar, but that's been some great work, not only in Project Aware, but it's really supported a lot of mental health across our state. And so that is definitely included, and we have seen a lot of that in our district plans and school plans with trauma, adverse childhood experience, and mental health programming.
Great. Thank you. Lori, another question somebody posted: does chronically out of school break out measures for grade levels? It seems that our lower grades are out for personal days, not sickness, and vice versa for the upper grades.
We allow local discretion there. So it is one of our measures, but how they do that specifically is a local decision. So we allow local flexibility in that area.
Okay. Kim or Alex, did either of you have any other sort of comments on that? I know.
I do not on my end.
Okay. And then the last question here, which I may be able to speak to a little bit, is have any of the speakers worked to align ESSA and needs assessments with the federal final rule on school wellness policies? Lori, have you all done any work around that?
Can you repeat the question? You went out a little bit. I heard wellness policies.
Sure, sorry. Have any of the speakers worked to align ESSA and needs assessments with the federal final rule on school wellness policies?
Well, when the federal regs came down about the updated local wellness policies, we did a lot here from our state office to support that. But as far as aligning with ESSA, it really falls in line with a lot that I've already shared with us supporting nutrition and wellness in our schools. So nothing major aligning with ESSA
Right. And I'll speak to that a little bit because that's something that Healthier Generation is definitely starting to look at, and we'll be doing some work around. We do have a local wellness committee toolkit that we're in the process of updating, and we'll be integrating information about ESSA into that. And we've started just and starting points really about developing some resources around ensuring that local wellness policies and school improvement plans align, and really building the capacity of local wellness committees to be involved in the needs assessment process at the LEA level. So that's all work that the Alliance and Healthy Schools campaign will be undertaking over the next several months. So stay tuned on that. So that, I know we're just about out of time and we're out of questions, I think. So I want to thank everyone so much for joining us. It has been a pleasure, and so grateful to our wonderful speakers for sharing their knowledge with us today. Alex and I's contact information is on this last slide, so feel free to reach out if you have any questions, and if we can certainly direct those over to Cam or Lori if it's a specific question for them. Again, we will send out the slides, so you'll have all of the links and resources that we talked about, as well as a recording. And one thing you may also be interested in, we'll make sure to send a link in the follow-up materials, is that we are now, the Healthier Generation and Healthy Schools campaign are sending out sort of a monthly newsletter update that will include any new resources we develop, as well as, you know, any new resources that we find other partners are developing that could be helpful in this arena. So you'll see that link, and be sure to sign up so you get regular updates from us. And with that, I will say goodbye. So thank you all so much.
Thank you. Thank you, everybody.
Thank you.
Thank you.